So today I'm going to talk about rivers in the body, and I want to think broadly about rivers. And what I mean by that, it's pretty much anything that involves flow. So flowing of air, flowing of water, flowing of blood, etc. So let's just think of a river for the moment. This is an incredible view from space. It's a simulation in a way of all the tributaries flowing into the Mississippi River. When you look at this, you think to yourself, wow, the Mississippi River covers a lot of this country. So today we're talking about STEM in broad terms. So think about aerial photography, not just of rivers, but if you think of applications of where you need to track things from space, that would be an application of STEM. Tracking deer populations, for instance. We know that they run into cars on the freeway, so that may be an issue. So could you track deer? Could you track deforestation? Could you track areas that need more water? There are a lot of things that you can think of that may need to be tracked that at the moment are not being tracked. So just look at this map of America. These are all the major river systems in this country. The purple one in the center is obviously the Mississippi. You may be wondering, well, what about Ohio? We're close to the Cuyahoga Valley National Park, and we have the Cuyahoga River. So that little red area there is Ohio, and you can see that there are two regions. One's green and one's purple. So you may think to yourself, why is that the case? And I know some of you are from the Akron area here today. Summit County, the word summit means the peak of something. Okay, so Summit County and that whole Summit Ridge is what demarcates one river system from the other. So it's just an interesting way of, you think of Ohio as being somewhat flat, but actually it's not. There are different river basins in this state. And tracking them may be important for farming and other reasons. So I said we're going to speak about rivers in general. And you think about river systems, you think of patterns. Okay, and so here we see a leaf. We might see a river. We may see roots of a tree. All of these things indicate flow of nutrients, flow of air, flow of water, etc. So we're going to speak about a number of flow examples today. I'm going to start off with airflow. We take this for granted. Okay, all of us are sitting here, or some of us are standing, and we're breathing, and we're not thinking about how the air gets into our lungs. Well, it goes through pipes. It goes through your mouth, it goes through your trachea, it goes through, into your lungs, obviously. And you may not think this is super important, but it is. Some people have asthma. Some people have cystic fibrosis. Some people have other lung issues that are super important, and we need to treat them. So how we get drugs into the lung is really important. And here's an animation of airflow into a person's lungs. Now you may say, well, this is some fancy photography. Actually, it's not really photography. These are computer simulations of airflow going into your lungs. So that is an example of engineering. How can you predict where the medications are going when you breathe them or have them pumped into your nasal system, either through a ventilator or a nebulizer? So there are systems out there. Here's a nebulizer. A nebulizer basically means something that takes tiny particles and delivers them into your lungs. So these are particles 1 micrometer or 1 micron in diameter. So that may not seem like a meaningful number to you. So a human hair is 100 microns in diameter. So imagine taking a human hair and dividing it up into 100 strips. The diameter of each of those strips would be 1 micron. So if you increase the size of the medication from 1 micron to 10 microns, you may not think that's a huge issue, but it is, because some of these nebulizers cannot deliver particles that are 10 microns into your lungs, and they get jammed up in the mechanism. So, as future engineers, you probably need to start thinking about how can I best get medications into a person's lung. Some of these medications are super expensive. So if I told you that for a pediatric patient in an intensive care unit, only 8% of the drug actually gets into the lungs, some of you may say, well, that's okay, they're getting some medication. Well, I ask you, what's happening to the other 92%? Why is that not getting into the lungs? And to be honest, right now, we don't really know where all that medication goes. Some of it may go to the atmosphere, some of it may get stuck in the machine that's delivering the medication, some of it may go in your mouth, some of it may go in your throat. The point is, that not all the medication gets to where it's supposed to get. So future inventors of this country figure out ways how to get better medications into the parts of the lung that need them the most. Let's switch to blood flow. And I'm going to speak about an unusual blood flow situation, and that's the blood flow into a person's brain. It's a super important thing, okay? You wouldn't be alive if you didn't have a brain receiving nutrients every minute of every day. And how the brain gets its nutrients is through blood that gets pushed up into the skull. So the problem there is that your bony skull is a fixed volume. So think of a bucket, and you're pouring water into a bucket. As you pour the water in, the water goes higher and higher and higher, and eventually it fills up and it goes out some exit. So what happens if that exit is blocked? That's the kind of thing that can affect some of these patients with what's called Chiari syndrome, is where the blood can go up into the brain, but the opening that allows the fluid to go back down to make space for the blood going into your brain, sometimes that opening is not correct. So if you keep on pushing blood into the brain, think about what might happen.
Always.
Violet, what are you doing now? You're blowing up.
I feel funny.
Not surprised.
What's happening?
You're blowing up like a balloon.
Like a blueberry.
Somebody do something. Call a doctor.
Stick her with a pin. She'll pop.
It happens every time. They all become blueberries.
You've really done it this time, haven't you, Wonka?
Okay, so if you keep on pushing things into something, it's going to expand. And the issue with this brain problem is that as the pressure builds up, the back of the brain gets pressurized and it gets pushed down into the top of your spinal canal. And unfortunately, that is the part of the brain that controls a lot of things. It controls nerves that go to your face, it controls swallowing, it controls vision, it controls balance. So if you have an issue with what I call this Chiari syndrome, and you've got fluid going up into the brain and it can't get down correctly to make space for it, you'll end up with patients who have balance problems, vision problems, pain, headaches, etc. So as future medical doctors, engineers, and scientists in the room, I ask you to think of better methods of imaging that tiny opening at the junction between the spine and the skull. How can we figure out which are the shapes that are going to be problematic? For a patient who does have this problem, can we come up with better surgical options? Can we come up with non-invasive options? Because right now, surgically opening up the space between the spine and the skull is tricky. So clearly doing something that's non-invasive would be very, very advantageous. Okay, skipping the brain, what about other situations? And I'm sure some of you have heard about blocked arteries. So, or coronary artery disease. So here's a situation where you can take a stent. It's typically made from some fancy alloy. You might have heard of nitinol. And they put these stents inside the artery to help keep it open. And here's a little animation of how that works. Okay, so they've got a balloon, and they've got the stent. They can inflate the balloon, and as they inflate the balloon, it pushes the obstruction away, and you'll end up with a stent that can then hold the artery open. It doesn't only have to deal with arteries. You also have a situation in the heart where sometimes your valve needs to be opened up because you have something called stenosis. And at the moment, the typical way to approach that is to do surgery. So surgery inside a heart. That is also a tricky procedure to do. You wouldn't want anybody digging inside your heart, fixing a valve. So could we come up with a non-invasive or minimally invasive approach for putting a stent-like device all the way into your heart? And here's an example of something we came up with. The difference in this stent case is that you don't want it to move. When the heart beats, you don't want the stent to pop up into the atrium because that would be certain death. Nobody wants that, correct? So you have to have a stent that not only opens, but it actually grabs onto the surrounding heart tissue. So here's an example of something that a team was involved with developing maybe about 10 years ago. Once again, you utilize a balloon. Who would have thought, as youngsters, you would have had so many applications of balloons? They're not just things that can be used on birthday parties or New Year's Eve. These are things that are used frequently in medicine to open up these stents. And you'll notice there, as the stent opens, because of the geometrical design. For those of you who like mathematics, this entire thing is based on isosceles triangles. Because of the design of those isosceles triangles, this stent can open up and make sure it doesn't move once you've put it in place. So just a recap of these isosceles triangles, for those of you who like mathematics, they have been designed in such a way that when you expand the base of these isosceles triangles, because they have different heights, the tops no longer match once you move the base apart, and the only way that can be accommodated is for the stent to open up and thereby grab the surrounding tissue. So it's a pretty clever design of a heart valve replacement. So here are opportunities for you in the future. Come up with heart valves that last longer, have less expensive surgical procedures, certainly ones that avoid cutting into the human heart. And if you can do things in a minimally invasive manner, so much the better. And also stents for tiny vessels, vessels that go into the brain, or your tear ducts from your eyes, tiny little tubes that might need to be opened. How can we figure out how to design stents to go in those small spaces? All right, numbers. This for me is fascinating. You can use animation to indicate flow of numbers. And what I mean by that is, look at this image here. Some of you may recognize it as Manhattan, New York City. So somebody has animated the number of cars traveling into and out of Manhattan. So here's a Sunday, not too much activity. Or Monday, wow, there are all of a sudden cars flowing in and out of Manhattan. Tuesday. This almost looks like a human heart. And my point here is there are so many applications for people in the future to come up with clever ways of indicating graphical representations. So this one, as an example, was flow in and out of New York City, shown graphically in a way that indicates flow. And the last one, you might have seen the show on TV.
It's hanging up there at the 4. Let's drop that red ball.
Come on down, straight down, straight down, straight down. No, no, no.
Oh, no, 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 no.
Oh, my goodness.
Oh, my goodness is right.
So the point of that ball moving down is like water flowing through a river or going through rapids. It is also your future career. At every junction, you're going to make a choice. Do I go left or do I go right? So here you are, you might think of yourself as freshmen in school, going through sophomore, junior, senior years. Eventually you could land up as a design engineer. If you take some different turns, go left instead of right, you may land up as a sports researcher or a physical therapist. There are so many opportunities for people in the STEM fields, just depending on whether you step to the left or step to the right can guide your future. And the other way I would like to look at this is flip this entire thing upside down. Engineering and science in general welcomes people with skills of balloons. You wouldn't have realized that. Woodwork, mathematics, all these skills that you are currently taking for granted can be used to develop a scientific or an engineering career. And with that, I'm going to end off with one last slide. There's an event here next April 4th, called Best Medicine. We have flyers at the back. It is all about bridging engineering, science, and technology. It covers a vast area. I'd encourage you to take part, speak to your teachers. Every student who takes part is guaranteed of winning a prize. Thank you.